Hello, my name is Kristen Widmer, and I'm going to be demonstrating how to do a cardiovascular physical assessment. So I'm going to introduce myself to my patient. Hi, my name is Kristen. I'll be your nurse today. Can I have you verify your name and date of birth, please?
Jonathan Widmer, September 26, 1986.
Thank you. Okay, so the first couple of things I'm going to be doing is I'm going to be listening to the heart. With any kind of a physical assessment, you're going to auscultate, palpate, inspect. But the first thing I'm going to do is listen or auscultate to his heart sounds. I'm going to start with the upper right hand side, just below the mid-clavicular line in the second intercostal space. I'm going to be listening for the aortic valve. Then I'm going to move straight over to the left side, same spot, mid-clavicular line, second intercostal space. I'm going to be listening for the pulmonic valve. And then right in the middle here, right on the sternal border to the left, about between like the third and fourth intercostal space, I'm going to be listening for what they call either Erb's point or the S1, S2 lub-dub sound. And then I'm going to move down to the left side of the heart, left side of the chest, I'm sorry, right into the fifth intercostal space, mid-axillary line is where I'm going to be listening for the apex of the heart, or what I like to call the true heartbeat. So I'm going to start by listening. And while I'm listening, I'd be asking my patient to just breathe normally so that I can listen to those sounds. The Erb's point, or S1, S2, is where I'm going to be hearing any type of murmur. And it's almost like a rushing sound. Okay, and after I've listened to the heart, I'm going to palpate. First, I'm going to palpate the carotid arteries. So make sure that you only palpate your carotid arteries one at a time. I'm not going to occlude both at the same time. We don't want to occlude both sides at the same time at any point. So I'm going to take my two fingers and put that just under the tip of the jaw and feel for that carotid artery. I'm going to let it go, and then I'm going to feel for the second. Okay, and at this point you can also use the bell of your stethoscope or just that other side. You're going to listen for to see if there is a thrill. So you're going to place the bell part of your stethoscope right on that carotid artery. You don't want to hear a thrill. Thrill is kind of like a rushing sound, or basically kind of that the blood is just rushing through. There's no actual pumping action, or there's not great perfusion coming to the brain. Okay, and I'm also going to palpate. So I'm going to kind of take it around the chest, make sure there's no like lumps, any kind of areas where it's hurting the patient or anything like that. I don't feel anything. And I'm also going to ask my patient a couple questions. So I'm going to ask my patient, are you having any kind of chest pain?
No.
Have you had any chest pain in the past? Anything that radiates? Any issues with dizziness upon standing?
No.
Not feeling like you're going to faint as soon as you get up or start walking around?
Nope, not at all.
Okay. And then from there, if you're going to go deeper into the vascular part of the system, you're going to feel for pulses. So I'm going to check both radial pulses. I like to check the radial and the pedal pulses just so that I can see the most distal part of the body has strong pulses. And the pedal pulse, I'm going to take the top of the feet, take down any kind of socks just to make sure that you have a better feeling of the pulse, and place that right on the top of the foot, just kind of perpendicular to that ankle bone. Okay, and at the same time, when I'm feeling the radial pulses and the pedal pulses, I'm going to check for capillary refill. So I'm going to take this finger and push down on the finger and see how long it takes for the color to come back into the finger. We usually want it to be below 3 seconds. That means that there's great perfusion down to the fingertips. And that is a cardiovascular assessment. Thank you.